I get it. Fevers are scary, but they don't have to be nowadays. Now, we have this natural fear of fevers because one, it makes our kiddo look like garbage, but also for thousands of years, a fever meant your kid probably wasn't going to make it. Before things like vaccines and antibiotics and virology and bacteriology, anytime a kiddo got a fever, there was a very good chance that they would become so ill they just wouldn't survive. But with those medical advancements, we've been able to pull back the curtain on fevers, realize what's really causing them, treat the underlying cause, and really make fevers a little less scary. Let me tell you some quick facts about fever and how to treat them or not treat them. A fever just means your body is recognizing and fighting infection. It helps mobilize white blood cells to go fight that infection, raises your blood sugar and your cortisol level. Fortunately, it does have some negative side effects. It increases your heart rate, it increases your respiratory rate, it increases your blood sugar. It makes us much more tired and sometimes gives us headaches and body aches. It also lowers your seizure threshold. Now, an important caveat, it's not the temperature or the fever itself that lowers the seizure threshold. Meaning you can have a normal temperature either naturally or because you've been lowering it with Tylenol or ibuprofen and still have a quote febrile seizure. Which leads me to my first really important point. You don't need to control the temperature in order to stop febrile seizures. In fact, treating the number on the thermometer really does nothing for you. If your child is uncomfortable, they're not eating, they're not drinking, they're not sleeping, that's a really good time to treat their discomfort using something like an ibuprofen or a Tylenol. But there's also no good evidence that rotating either one of those is actually gonna lower the temperature or significantly contribute to increased child's comfort. Really important to remember that most viruses will generally cause 3 to 5 days of fever. And that fever is gonna go up and down throughout the day, most often peaking in the afternoon and evening hours and going away sometimes during the morning and early afternoon. So when should you worry? Well, when you're not noticing other symptoms associated with the fever or you're only noticing one symptom. For example, fever with pain with urination. That's concerning for a bacterial infection of the urinary tract. Fever with only an earache, and especially that earache comes at the end of an otherwise normal cold. That's concerning for a bacterial infection of the ear. But if your fever is accompanied by multiple symptoms like runny nose and cough or vomiting or diarrhea, that says the body is fighting off the infection and it's a normal part of that infection. I always recommend though that if a fever is going over 5 days, or if it's been going for a few days and you're butting up against a weekend, to get checked out. Finally, there isn't a height of a fever that particularly concerns me. For example, fever of 104 does not mean your brain is gonna melt. I've taken care of lots of kids that are at 106, 107, and they're healthy enough to go home, and I've sent other kids who are only at a temperature of 99 to the ER because of how they look. Your child's appearance and how they're behaving is much more important than a number on a thermometer. So don't fear the fever. Let it be your friend to help you determine how to best take care of your child.